Okay, bless everyone. Today, let's talk about the basic principles of health education, including mental health and other related issues. Before we come to the practice of health, we must know the principles involved. Health education brings together the art and science of medicine and the principles and practice of general education. Health education cannot be given to one person by another. It involves inculcation of habits concerned with the objectives of healthful living. Each individual learns and through learning develops the moods of behavior by which he lives. Learning and teaching are two-way process of transaction in human relations. Teacher cannot teach unless pupil wants to learn. It is possible to observe certain principles of learning and use them in health education. There are 12 basic principles of health education. Number one is credibility. It is the degree to which the message is perceived as trustworthy by the receiver. It should be scientifically proven, based on facts, and should be compatible with local culture and goals. Number two is interest. If the health education topic is of interest to the people, they will listen to it. Health educators should identify the field needs of the people and then prepare a program that they can actively participate in to make it. Number three is participation. Health educators should encourage people to participate in the program. Once the people are given a chance to take part in the program, it leads to their acceptance of the program. Methods like group discussion, panel discussions, etc. provide opportunities for people's participation. Number four is motivation. The fundamental desire for learning in an individual. Health education can be facilitated by the motivation provided by the desire to achieve individual goals. For example, for a teenager, aesthetics might be a motive to take care of his teeth, whereas for an adult, the expenses of undergoing restorative care. Number five is comprehension. It is the level of understanding of the people who receive the health education. It should first determine the level of literacy and understanding of the audience and act accordingly. Words that are strange or new to the people should not be used. Use of technical terms or medical. An example is a statement saying eat food items that are carcinogenic may not be comprehensive to the layman. A better way of explaining would be avoid foodstuffs which are sweet and which stick to your teeth like toffees and pastries. Eat food items like fruits and raw vegetables which in addition to being healthy also help in keeping your teeth clean. Number six is reinforcement. This is the principle that refers to the repetition needed in health education. It is not possible for the people to learn new things in a short period of time, so repetition is a good idea. This can be done at regular intervals and it helps people to understand new ideas or practice better. This is also a booster dose in health education. Number seven is learning by doing. If the learning process is accompanied by doing new things, it is better instilled in the minds of people. If I hear, I forget. If I see, I remember. If I do, I knew. Number eight is known to unknown. Before the start of any health education program, the health educator should find out how much the people already know and then give them the new knowledge. The existing knowledge of the people can be used as the basic step up on which new knowledge can be placed. An example, a health education program with the aim of introducing a toothbrush to a rural population will be better appreciated if the communicators start the program with what are you using to clean your teeth at present, and then going into details like why are you using it, and then connecting it to the toothbrush and then providing details about the toothbrush. Number nine is setting an example. The health educator should follow what he preaches. He should set an example to others to follow. Example, a health educator who participates in a program highlighting the ill effects of tobacco should not be seen smoking since it sends a wrong signal and seriousness of the situation is lost. Number 10 is good human relations. This principle states that the health educator should have good personal qualities and should be able to maintain friendly relations with the people. The health educator should have a kind and sympathetic attitude towards the people and should always be helpful to them in clarifying doubts or repeating what is not understood. Number 11 is feedback. For any program to be successful, it is necessary to collect feedback to find out if any modifications are needed to make the program more effective. Number 12 is community leaders. Community leaders can be used to reach the people of the community and to convince them about the need for health education. Leaders can also be used to educate the people as they will have a rapport and will be familiar with the people of their community. The leaders will have an understanding of the needs of the community and advise and guide them. Next is the mental health issues during the COVID-19 pandemic. These are the 12 factors affecting the prevalence of stress, anxiety, and depression among the general population during the COVID-19 pandemic. Number 1 is lack of infectious disease knowledge. Number 2 is lack of health behaviors. 3. Lack of mental health assessment and self-judgment methods. 4. Economic problems. 5. Change in sleep patterns or nutrition. 6. Sleeping problem or concentrate. 7. Facing great changes and inadaptability. 8. Lack of physical and mental health knowledge. 9. Lack of psychological coping methods. 10. The impact of social media. 11. Quarantine. And 12. Fear and anxiety for your health and the health of your family. Thank you for watching. Goodbye and God bless.